Welcome to the conversation. Today's conversation is with Dr. Srinivas Ramaka. Dr. Srinivas Ramaka is a doctor with a kind heart. I know Dr. Srinivas Ramaka for past 2 decades. I think almost 2 decades since the inception of Global TV. The great work that he is doing in creating awareness on cardiac arrest and to avoid the sudden death of people, the kind of programs organized. He is a LIMCA record holder for conducting the large such program. Over 4,000 people participating in that program, I remember. The great work addressing international forums and working at the grassroots level in Warangal and around in many parts of the country, and got appreciations from great people. I am coining a new term called P-Tech, not B-Tech, it is P-Tech. Most of the people are high-tech, and I see Dr. Srinivas Ramaka as P-Tech. P-Tech means practical tech, practical in applying technology. I remember we had an episode done long back when we were using tele-recording. Broadband was not there in those days. It was a World Heart Day. We had two guests, Dr. Ramaka joining from Warangal and another doctor joining from Nagpur. I suggested both of them to come over phone and talk to me, and I told we have tele-recording, and that is how we are taking. Then we are adding clips, video clips and visual images and making the episode. Dr. Srinivas Ramaka immediately did it, and we recorded and created the file. Whereas the doctor in Nagpur told me, I am high-tech. We have all the facilities here. We will do it on our own. We will send you the file. I agreed. And it took him to do the work almost 15 days. We had to wait for doing the telecast. This is what I am telling, the importance of P-Tech. We should be practical. We should be, I say, we should apply CS technology in introducing anything to society. CS technology is common sense technology. And my congratulations to Dr. Srinivas Ramaka for the great work that he is doing in the field of medicine and at the grassroots level. Sir, please enlighten our viewers about some of the great works that you are doing in the field of cardiology and creating awareness in the area, sir.
Thank you, Mr. Paul, for the kind words and nice words. See, I would like to emphasize that what I am doing is nothing great. This is a ground level work which most of the doctors are doing and they have to do. See, as far as the medicine is concerned, most of us, we feel that it is just routine practice, routine clinical practice, examining a patient and diagnosing a disease and providing treatment, whether it's a medical treatment or interventional treatment, particularly in relation to cardiology, interventional cardiology. But in my opinion, the cardiology work in specific and medical practice in general will and should start from the consultation room and extend to the community and beyond. This is what I call, because recently when I gave an oration 1 or 2 years back, the topic was from the consultation room to the community, the journey continues. Because ultimately our patient population is from the surrounding community. And it is not only individual health. If we improve individual health, the community health will be improved. And if we improve community health, the societal health, the regional health, the district health, and then the state, the health of the state, and even the national health. And ultimately, what I would like to emphasize as far as the World Heart Day theme of 2009 and 10, if I remember correctly, the health in aspect to the economy. So if the societal health is impacted, if there's a ill society, then it will impact the economy and the economy will be in shambles. So that's the relation with us. So ideally, from the consultation room to the community, we should do it. Second thing is, there are 3 C's. All these 3 C's should be linked. What are the 3 C's? Consultation room, community, and then the CCU, cardiac ICCU, and the cath lab. All these three things, because whatever you do in the community will impact the people coming to your consultation room. And then if you are giving good evidence-based treatment, or if you are giving a proper awareness to the community, the awareness on the cardiac health will be improved. The outcomes are also improved. See, suppose most of the people who come to my clinic will ask me, sir, what are the symptoms of heart disease? How do you diagnose heart disease? How do you treat heart disease? If you create awareness on heart disease, for example, a simple thing like, suppose what is the type of chest pain which is likely to be suggestive of a heart disease? If we clearly tell them, then they will know when to contact a physician, a doctor, or a cardiologist. Suppose if he doesn't know which is type of pain, he needs to consult a doctor, and if he fails to consult, then we see so many instances of delayed diagnosis, and a delay in diagnosis may be leading to morbidity, like disease outcomes will be poor, and even sometimes it may lead to sudden death. Suppose if he thinks it is not cardiac, but really if it's a cardiac pain, and if he doesn't consult a doctor, like we see so many instances of out of hospital cardiac arrest. So creating awareness on cardiovascular disease is the most important thing. For this, in 1999 onwards, from the day I started, from what the questions the patients coming to me as, we started and initiated a program what is called as a Know Your Heart program, creating awareness on starting on all aspects of heart health, starting from the anatomy of the heart, like where the heart lies, which chamber is affected, what are the structure of the heart is involved, and then type of heart, Know Your Heart program. Ultimately, based on this, we have written a small booklet, then I have written one booklet in our local language, Telugu. Then subsequently, this Know Your Heart program, right now my aim is to write in the national language, Hindi, and then get it translated to other Indian languages also. The other awareness on heart disease which we can do it is particularly about risk factors of heart disease, like diabetes and heart disease, hypertension and heart disease, tobacco and heart disease, family history and heart disease. We created small PowerPoint programs and CDs on each of these topics. Particularly, one important area where we have diversified is tobacco prevention. Tobacco is the most common preventable cause of death, and with that in mind, every year we have been, apart from the World Heart Day, which creates awareness on heart disease, World No Tobacco Day on 31st May we have been doing regularly. On tobacco prevention also we have been doing regularly. We created a pamphlet on the ill effects of tobacco in the local language and also in English. Then we translated the COTP Act and the National Tobacco Control Program, what we call the NTCP. We have done some advocacy efforts also, like how the National Tobacco Control Program about the implementation of tobacco prevention at the district level, state level, and national level through the RTA, like Right to Information Act, how it is implemented throughout the country. Ultimately, tobacco prevention, if we implement it strictly, the health outcomes would be improved, disease prevention would be more, like all the ill effects of tobacco would be prevented thereby. So this is one aspect which we have been doing. And another aspect from 2009, what I have been doing is knowing the lot of instances of sudden death in the out of hospital situation, what we call as out of hospital cardiac arrest. We initiated the CPR training for lay public. We started very small way in 2009. Like we had what we needed, the models, the mannequins. These are important models of training the lay public on these models. We had only one at that time. Subsequently, we procured some more mannequins, or 20 little lining mannequins, as they are called, and through them we NCC cadets, NSS cadets, training the railway station staff, and then the bank people, the press personnel, journalists, and both private and government offices in and around Warangal, some of the surrounding districts, and even, as you know, see, these instances of sudden death occur more and more in the public places, like even the temples, churches, and then the masjids, religious places and all. So people who come to my clinic from all these backgrounds, I was telling, for example, one of my classmates who is who goes to church regularly, I trained him in CPR, and he passes the knowledge to the when he goes to the church on Sundays and all. But I gave him a demonstration of the temple stuff. So this, now we incorporated what we call as the National CPR Challenge campaign, where the ground level people who come to my clinic, each of them, like each one train one with that concept. Suppose if I train one, he'll be training the other. Like if some local sarpanch or village sarpanch comes, a villager comes, he has to train his villagers. Similarly, if a policeman comes, he'll train his surrounding police colleagues and all that. Some MLA, MP comes, he'll pass on the knowledge because these people are important. Because we need a very strong political will in our society to impact the society anyway. So, the MLAs, MPs, ministers, if anyone frequenting my clinic, I train them in CPR, then they pass on the information to the government so that the importance of CPR will be important. So ultimately what I would like to say is nowadays the American College of Cardiology and the American Heart Association has given a guideline that all patients, all the family members of those with high risk heart disease, they need to be trained in CPR and awareness on heart health. Suppose in case the family member who has a heart disease has a sudden event, then this family member who is trained in CPR and heart health, he needs to be aware of the cardiac symptoms. And suppose, unfortunately, if someone has a cardiac arrest, he'll perform CPR. Then he'll take him immediately, call the ambulance, and take him to the nearest cardiac center. So thereby the outcomes are improved. So ultimately, it is not me alone. Everyone in the society, particularly every medical professional in general, and every cardiologist, apart from the practice which is done routinely, if these things, like if we spare some of our time for creating awareness and performing these layer SQR CPR training programs, tobacco prevention, then awareness, but maybe the outcomes among our patient community and the societal outcomes are also will be improved.
I suggest media and youth should join the medical professionals in creating awareness on CPR. Every youth should be trained in CPR. And it is something like it's a basic responsibility of the youngster. I'm not saying that others should not learn, but every youngster should specialize in CPR and the media should join hands. So a triangular strategy, media, youth, and medical professionals coming together, we can have a national campaign strengthened. And talk something about that, sir.
There are some countries which have created cultures of excellence in creating awareness on CPR and improving outcomes from out of hospital cardiac arrest. To tell in simple terms, out of hospital cardiac arrest is a cardiac arrest, a sudden cessation of the heart activity which occurs in a out of hospital situation where there is no organized medical system. If it occurs like in public places, the commonest place where a sudden cardiac arrest occurs in out of hospital situation is a home, residence. So first create awareness on the family members. Okay. Second point is public places, railway station, airports, bus stands. Okay. Then other maybe on the road. Like we did a study on media reports. The study title was last 20 years, the cardiac arrest, reporting of cardiac arrest in the Indian print media. Hindu, Indian Express, Times of India, particularly Times of India, Hindu, Indian Express, and other miscellaneous English newspapers. How many cardiac arrests, with a search item of cardiac arrest in their website, we did it in the Google search, in their this thing. And out of these cardiac arrests, how many of them are out of hospital cardiac arrest? We surprisingly, meeting places, polling stations, we can see whenever there's a polling instance, polling station, either the election officer or someone who came for voting, there's a cardiac arrest. So with this background, the role of media in creating awareness is most important, as you have told. Two, there's what is called the targeted CPR training. Starting from school children, high school children, both junior college and degree college students, they should be trained in CPR. The other important aspect is there are some countries like Scotland, Denmark, UK, where they aimed at training more than 50% of the population in CPR. And they did it. Okay. Now, the other thing is, I would like to tell the audience about a concept called as chain of survival. If the chain of survival links, the points in the chain of survival are improved, then we can tackle the out of hospital cardiac arrest and improve the outcomes. What is the chain of survival? As for the international guidelines and the American Heart Association is concerned, where what is called as the early recognition of cardiac arrest. When, suppose, for example, you are hearing instances of celebrities having sudden cardiac arrest either while performing or while after going to their venue, like the stay, hotel stay, or anything like that. Recently, we had one of the popular singers who had a sudden cardiac arrest. A popular actor from Karnataka who had a sudden cardiac arrest. Okay, we had a cricketer from Australia who had a sudden cardiac arrest in the out of hospital situation in Mumbai. Okay, and another cricketer in probably abroad also. These are instances of out of hospital cardiac arrest. I can give you so many examples of this out of hospital cardiac arrest, or what is called as popularly as OHCA in medical parlance. OHCA. Okay. So early recognition of cardiac arrest. Recognize how do you recognize cardiac arrest? There's no response, there's no breathing. Recognize cardiac arrest. Then what do you do immediately? Immediately we have to call the ambulance system. Recognize the cardiac arrest and do that. But what do you see in our situation? Most of the people, they get panicky. They suddenly, like someone has a cardiac arrest, suppose someone has a cardiac arrest in the family, in the house, in the residential locality, or within the house, like one of the nearest family member, or what you call the bystander, he'll start crying or he gets panicky, runs for an auto. Do we get a auto immediately? It is difficult. So ideally he has to call the ambulance. So how early should the ambulance come? It should come within less than beyond 10 minutes. The person CPR, if he is not saved, like if you don't attempt CPR and the pulse is not regained, then the chances of survival are very poor. 2. What is cardiac arrest if it doesn't have the awareness? How do you know? How can I recognize cardiac arrest early? So unfortunately, the awareness on cardiac arrest is not even 2% in the Indian population. So it is the role of the media, it is the role of the governmental agencies, health department, to do periodically. You cannot have yearly one day and train them in CPR. Every day, like we are doing advertisements in the media, it is particularly the Doordarshan and passionate people like you should create awareness on this cardiac arrest. So early recognition of cardiac arrest and early call to the ambulance. That's the first thing. Second thing is, after recognizing cardiac arrest, while the ambulance arrives, the bystander or the lay rescuer or the lay responder, as is popularly called, has to immediately perform early high quality CPR. High quality CPR is we have to perform chest compressions correctly. For this, right now the American Heart Association gave a guideline that earlier we were training on simple mannequins. Now each of the mannequins which we have, they have got a gadget inside. We link it with the Bluetooth to the iPhone or iPad app, and this gadget will give a scoring like that, whether the person we are training is performing the chest compressions correctly or not. That score should be above 80 or 85%. Above 80%. That score is called the chest compression fraction. Chest compression fraction is the percentage of chest compressions or the duration during cardiac arrest in which the chest compressions are correct, like are effective chest compressions. So the effective chest compressions are 100 to 120 per minute, at least 2 inches in depth or 5 centimeters in depth without any interruption. Okay, and chest wall has to recoil back to its original position while doing chest compression. This you can demonstrate in the video which I shared with you, a YouTube link. So this is high quality. Third thing in the chain of survival is recognize cardiac arrest, call the ambulance first thing. Second, high quality CPR, performance of early high quality chest compressions. Third thing is automated external defibrillators, early defibrillation. Along with chest compressions, if you are using the defibrillator, like in the hospital we have the manual defibrillator, in the out of hospital situation there is called as AED, automated external defibrillator. Using this, you have to give a shock if it is available. The fourth one is once ambulance comes, early shifting to the ambulance. And the fifth one is through the ambulance, through the emergency medical services system or ambulance we have shifted him for post-resuscitation care to what we call the cardiac arrest centers or the resuscitation centers. Then there's the fifth one. Sixth one is once we give effective evidence-based treatment in the cardiac center, ultimately the person will be recovering with a fully conscious or a fully recovered neurological state. These are the 6 links in the chain of survival concept. And each of them should be effective in improving the survival of an out-of-hospital cardiac subject. Now, for example, if we take an example of some celebrity or a common man having a cardiac arrest. So suppose one of the singers who had a recent cardiac arrest, he felt unwell on the Paul, what I would like to tell the audience is these things are we don't anticipate. Suppose we are doing something really good, like we are doing an entertainment meet or a public meeting. We don't expect that someone will suddenly have a cardiac arrest and die. We don't expect these things, but we should be preparedness is most important. Preparedness for that. Now, preparedness is not you and I, we are not giving the guidelines. These are international guidelines. For example, if you are conducting a concert, if you are conducting an entertainment meet, how many people should be there in the audience? Okay, and even if it is not the celebrity alone, even if a common man in the audience has a cardiac arrest or something, uneventful event, then we should be trying to save him. So the important thing is, a trained paramedics should be available in a meeting. Even yesterday, I was going through the WHO has given a guideline. What is a large meeting? Anyone with above 1,000 is a large meeting. So in that condition, we have to have trained paramedical people trained in CPR. A trained paramedic means they are expected to be trained in cardiopulmonary resuscitation. And even I was telling, isn't it? Any public place or a private building, a meeting place or a hall, library or a lecture gallery, entertainment center, Disneyland, anywhere in the world, or a gym or wherever it is, the staff should be trained in CPR and definite guidelines are there, and automated external defibrillator should be installed in that place. Okay, for example, we have a secretariat, isn't it? We have the assembly building, we have the Indian Parliament. Really, I wonder whether all the staff in our secretariats, where our IAS officers will be there, and the assembly buildings where our legislature will be there, all our MLAs and our MLCs will be attending. Okay, and registration offices, small registration offices, and the RTA, like the road traffic, where we get our driving license and all that. These are places where public will be going and all that, isn't it? Or restaurants, hotels. I really wonder whether really the staff are trained in CPR or not. Suppose, so with that in aspect, we are trying to train everyone in these public places in CPR. Last time, in one of the court buildings in Warangal, I gave a demonstration on CPR. And we have all the residential apartments, like we have the big apartment buildings coming nowadays. I suggested to one of the contractors or builders that in a residential building, an automated AED, automated external defibrillator, should be installed in that apartment building. If a district collectorate is there, an AED should be installed in each floor. Okay, and so in all the public places, in general, libraries, hotels, restaurants, the residential apartments, buildings, court buildings, secretariat, assembly, including the Indian Parliament. See, all these places, starting from where a common man attends to a highest level office in our country, there the staff should be trained in CPR, trained paramedics should be available, and then AED should be installed. And all these places, if you are conducting a meeting, a concert, entertainment, or a big political meeting or wherever it is, including a cricket, BCCI conducts, we have all these IPL matches. I really wonder, Mr. Paul, do you have any idea whenever an IPL match is concerned, is there a trained staff in CPR in that place?
No evidence, no idea, sir. No, it's not.
How many cricket stadiums in our country have a AED installed? Not one AED. In each gallery around, there should be one AED at least. do you have any information whether an automated defibrillator is installed?
It's not available. It's not
So,
information is not available. Yeah.
in all these places, we have to take precautions. So, probably if you have taken precautions in the availability of a trained paramedics around, and if immediately an AD is available, maybe we could have saved some of these. We could have saved some of these celebrities. That's one thing. Second thing is I'll just tell one example. See, all these points are not to pinpoint it personally at one person, but for example, one of the singers who had a cardiac arrest recently, he performed the session, entertainment session perfectly. But in between, he felt sick. He felt unwell. So what should have been done was a medical personnel or someone should have inquired from him, or he should have taken the help of a medical person nearby. So during the entertainment concert, a medical person, if it's a need that he should be made available. Two, and if he is available, the medical person should have inquired the symptoms. And if the person had complained of chest pain or any complaint, if he had any complaint related to cardiac symptoms like chest pain or breathlessness, an ECG could have been performed, which doesn't take much time. And if ECG is normal or the pain, even if it is suggestive of a cardiac problem, then he could have attended properly. And then the reason is some of the majority of the patients do not have definite symptoms. They may be asymptomatic also. Some of these subjects of out of hospital cardiac arrest may have prior symptoms of heart disease, like chest pain, breathlessness, palpitations, giddiness, vomitings, and all that. So when he is felt unwell initially, should have been attended, one thing. Second is, we have seen from the videos in the media that the person who felt unwell was suddenly rushed with 4 or 5 people. Rushing means he was made to walk, which is not correct. When someone is unwell, without inquiring the nature of his symptoms, we do not know what exactly is happening inside. He must have had a regular pulse or irregular pulse, because the commonest cause for a cardiac arrest is a normal regular pulse will become dangerously irregular to what is called as a ventricular tachycardia or ventricular fibrillation, which is the cause for cardiac arrest. Okay, how do you recognize? We have to inquire from the symptoms, take an ECG, and the person is made to rush. He was made to walk. Ideally, a wheelchair provision should have been there. So, whenever you are doing a big meeting, we do not know who has a certain problem. See, cardiac arrest is the worst thing, but even if someone is unwell, do not make an unwell person to walk, because that itself is a physical stress that will create a stress over the body. So, a wheelchair provision should be made in all these public places, particularly the big concerts, meeting places, and the large buildings. So that, suppose, what do you do? Like, suppose someone is physically challenged. Do you make him walk? No. You suppose if he is unable to walk, the minimum thing is you have to give respect to him by making these things. If you go abroad, most of the even cine halls, lecture galleries, theaters, see, I would like to ask one thing. How many of the galleries you have seen have a provision of a ramp? Everywhere you find only steps, isn't it?
Yes.
Have you seen any Indian gallery or meeting place where there's a ramp?
No, only shopping malls we have.
A ramp. What is the use of this ramp? Suppose if we have a physically challenged person going to these places, if we use the wheelchair, through the ramp, the person can be transported. So yesterday, when someone is a cardiac arrest celebrity, was made to walk. So wheelchair provision is most important. The third, another thing which I have to tell you is, earlier when one of the chief ministers, when he used to come to in and around Warangal or Telangana districts, I was called to accompany in the convoy. See, I'm not telling only VIPs should be given importance. Even the common man should be given importance. And when the VIP is attending these places, when I was asked to accompany in the convoy, I used to go with everything, like the ECG machine, defibrillator, everything like that. Okay. Now, in the VIP convoy, mainly abroad, like they have the full history, which maintaining the privacy, and everything will be in place. See, our VA convoys. See how many VIPs as per the medical guidelines, we have to attend in the convoy. That's a very important thing. It is just not for namesake alone. So when a celebrity is coming like that, we had, for example, if the same case, if we had followed very strictly, maybe we could have saved our past beloved President Abdul Kalam. He was attending one of the reputed institutes in the country, and when he had a sudden cardiac arrest, the CPR was also not performed correctly. When one of the MPs had a cardiac arrest in the Indian Parliament, when the budget session was going on, even the presidential staff, but none CPR was also not being performed correctly. So maybe what is important, what I would like to emphasize is there is what is called as the return of spontaneous circulation. When someone has a cardiac arrest, either in the home or in the public place like railway station, airport, malls, meeting place, or any of these places, if the early recognition of cardiac arrest is done and high quality CPR is provided, if an automated external defibrillator also is used in converting the abnormal rhythm to a normal rhythm, and this is done by a bystander, then if the pulse is regained on site, this we call as a return of spontaneous circulation. But what is seen commonly in our country, someone has a cardiac arrest and he is taken, when he is taken, immediately he was rushed to the hospital, and on the way he died, and by the time he is taken to the hospital, he was declared broad dead. So ultimately what without pinpointing at any, the system needs to be improved. This is what is called as improving the resuscitation systems of care, so that every link in the chain of survival concept is improved. And even if we do it, the best of the systems in the world, the average survival of out of hospital cardiac subject is 10% average. The best system in the world we can reach by following the optimization of the links in the chain of survival. We need to, the survival can be improved to 50%. So in this aspect, I would like to give one suggestion through the media, through global TV. Like in any other country, in some countries where the systems are done perfectly, they have created what is called community responders. A community responder is like they created an app in a app, and anyone who downloads the app, for example, they say, for example, Mangalore is an area. Paul, with the help of his software friends, he creates an app. Okay. Or in Warangal, we create an app. And in Mangalore, once we create an app, whoever has downloaded the app, when someone has a cardiac arrest in and around that area, all these people who downloaded the app, for them, the message will go that someone has a cardiac arrest. So whoever is nearby can go immediately and help them in performing CPR. And then suppose same thing is in internationally, we have, suppose the AEDs are installed in all places in Mangalore. Like you look how this installation of AEDs is what is called the public access defibrillation. Recently in Bombay, in all the metro stations they have installed, and with that some people have been revived also. Like along with CPR, usage of a defibrillator shock, like people have been revived and the survival rate has been improved. So same thing. So this is creating a cohort of or group of community volunteers or community responders who can contribute to improving the survival rate of an out-of-hospital cardiac arrest subject. So we have so many things going on throughout the world. Ultimately, what is important is with the amount of resources and amount spent on most of the things in the world, if we spend part of it for this aspect, maybe like even if one life is saved from creating awareness on cardiac arrest, learning CPR, performing of timely CPR, usage of automated defibrillator, and shifting in a timely way using an ambulance to a cardiac center and performance of evidence-based treatment, maybe we have a fully recovered subject. It is in my experience, we had so many subjects. Even some of my patients who learned CPR, villagers, they could save their family members from CPR, from out of hospital cardiac arrest.
1 minute concluding message. What campus can do in creating awareness? Campuses in India, what they can do? 1 minute a message, sir.
Each one train one. That is the message. Suppose if I train one person in the campus, a high school campus, a junior college campus, or a degree campus, or a professional college, or a non-professional college, anything other than professional colleges. If and we have institutes, a campus need not be a place where it awards degrees alone. Like even if there is a secretariat building is a campus, even our legislature building is a campus. Okay, or even if our Indian Parliament is a campus. If I train one MLA, he has to give the information to all the other MLAs in knowledge on CPR, and they have to see that the government head, whichever party they belong, this awareness on CPR and the provision of automated defibrillators and creation of what I call 3 A's: accessible, affordable, accountable cardiac arrest centers, where a person after if he has ill or unwell suddenly, the cardiac arrest center or a ICCU care is accessible to anyone. It should be affordable and it should be accountable also. Then we can, through years, then we can improve the survival of these subjects. Okay, that's a campus can. Suppose if I train an MP in CPR, he has to train his other colleagues in CPR. If I train a villager, another one. Including I have some army personnel also coming to my clinic. Indian Army people like soldiers, those from the Air Force and all that coming. So I used to train them and they are. So my ultimate aim is to train everyone in CPR, rescue CPR or lay response CPR in the country through the National CPR Challenge campaign. And ultimately, I would like to envision a place where no one will die of sudden cardiac arrest in the country. See, right now, as far as the study which I have conducted earlier, survivability is varying between 0 to less than 1%. The Warangal area out of hospital cardiac registry or the media study like that. So at least we had reached the international standard of 10% at least. Then, which is not it might be difficult, but not an impossible thing. With people like you, with people like living in the media, I think this is possible, and we need more and more such events to create awareness on cardiac arrest among the lay public. And see, lay public need to be made aware. But what is important, we have to sensitize the people in the upper hierarchy, like our government officials, health department officials, the ministry cadre, MLAs, the legislature, executive, and even the judiciary also. Why I'm talking of judiciary is the honorable judiciary, with due respects to them, they have to see that the government authorities and the government officials, everyone, both in the executive and legislature, whether they're implementing it correctly as per guidelines or not. It's the responsibility of the judiciary to take everything suo moto and see that these things are implemented strictly. Thereby, maybe what more do we want apart except survival of a subject of cardiac arrest? That's the greatest thing. Giving life to a subject, isn't it? So that's which I envision, and that's a message which I would like to give. Maybe every high school student to a professional level, they should learn CPR, then impart his colleague. So that's the reason I each one train one.
Yeah.
Concept of.
Let us take the campaign, each one train one, and let us go for media and campus and youth. Now you told every campus, means campus is not restricted to education campus, every place, every campus, and let us take it forward, and we will achieve the vision of Dr. Srinivas Ramaka. Thank you very much, sir, for joining us. Thank you, sir.
Thank you.
Thank you, sir.